We've talked in the past with doctors David Calcagno and John Rossi about many topics involving varicose vein treatments, but a lot of folks still have a bunch of questions. So today we get to play Ask the Vein Expert. Dr. Calcagno of Calcagno and Rossi Vein Treatment Center is here to answer frequently asked questions. Fantastic idea. We're going to jump right into it because, again, folks do have some questions. So we're going to take one. This was from Beth in Mechanicsburg. She asks, what factors predispose people to get varicose veins? What do you say, doctor?
Well, the two main factors are heredity and pregnancies. It's this latter factor, that's why women are more prone to varicose veins than men.
Oh, interesting. Here's a really good question. Kim from Harrisburg wrote in and asked, does my health insurance cover the treatment of varicose veins? Everybody thinks about finances.
Yes. Insurance usually covers varicose veins as long as the patients have symptoms. These symptoms can be pain, heaviness, tiredness, aching. And also, most insurance companies in this area require the patients to wear compression stockings for several months before they approve procedures.
Okay.
So if someone's thinking of having their veins corrected, they may want to go ahead and start the stockings.
Oh, that's a good idea. Get started now. Here's a really good question. This is from Mike in Duncannon. He asks, are varicose veins bad for your health, or are they just a cosmetic concern? We've talked about this on the show.
Yes, and varicose veins are not just a cosmetic concern. As we've talked about on the show, varicose veins often have leaky vein valves. So instead of the blood returning to the heart like it should, it's actually going backwards down the leg. And this can cause very high vein pressure in the legs. And it's the high vein pressure that causes the health problems. This can be things like pain, swelling, and with prolonged high pressure, even the white blood cells and red blood cells can seep out into the tissues, causing the skin to darken, get thick, and in the worst cases, even ulcers. So, and also when blood's just sitting around in veins like that, unlike water that stays liquid, blood can clot. So to answer the viewer's question, no, varicose veins are not just a cosmetic concern.
Right, that might be your initial concern, but it goes far deeper than that. Here's an interesting question too. This is from Deb in East Berlin. She wants to know, are varicose vein procedures done in the hospital? Would she have to be put to sleep?
No, at Calcagno and Rossi, we do all of our vein procedures right in the vein center, and they're all done under local anesthesia.
Wow, I know, you've even done one here on the air, a little bit of a procedure. It was so easy. Last question is from Emily in Hanover. She wants to know how long she'd be laid up after a varicose vein procedure, how much work she would miss.
She should not. At Calcagno and Rossi, we encourage immediate ambulation right after the procedure, and so people can return to work or exercise the next day.
Wow, this is great. So if folks now are intrigued, you have an event coming up the next 2 days.
Yes, we have a vein screening tomorrow and Wednesday.
Perfect, and I know it begins at noon, right? And they should call and make an appointment so you know how many folks to expect. Perfect. This has been great. Thank you so much for bringing these questions that a lot of our viewers have right back to the viewers. We appreciate that.